Good evening, this is Viewpoint. I'm Zakka Jacob. Even as the second wave of Covid-19 seems to be subsiding, certainly in the big cities across the country, get ready for the third wave, says the central government, and the third wave could well likely affect children. Now, so much so, the centre is saying that parents need to encourage kids to start wearing masks inside their homes. Now that, as any parent would tell you, is easier said than done. So in the absence of a pediatric vaccine for Covid-19, how prepared is India for Covid on our kids, which could be the third wave?
As the second wave is showing signs of subsiding, the country is already preparing itself for an inevitable third wave. In the first wave, the elderly were most affected. In the second wave, young working professionals were hit. But in the third wave, children will be most at risk. The virus is forever mutating and on the lookout to attack as many hosts as possible. Since the elderly and to some extent the above 18 age group have already acquired immunity through natural infection and vaccination, children will be most susceptible.
दिसंबर वाले सर्वे में आईसीएमआर का जो था उसमें ये दिखाया गया, उसमें हमने 10 साल तक सर्वे किया था और उसमें ये दिखाया गया था कि उस टाइम पे जितना व्याप्तता एडल्ट्स में है 10 साल के बच्चों में जीरो पॉजिटिविटी लगभग उतना ही है.
India is a young nation with 41% of people below the age of 18, and the vaccine for this age group is still in development phases. Bharat Biotech's Covaxin has already got approval for phase 2 trials, which are likely to begin in another 10 days.
जो कोवैक्सीन है हमारा वैक्सीन, उसको परमिशन दी गई है कि वो बच्चों में आप ट्रायल आगे लेके जाएं.
The Health Ministry has already issued an advisory that children should wear masks even at home and practice social distancing at all times.
बच्चों को इफेक्ट होता है, एसिम्प्टोमेटिक होते हैं, लोग स्प्रेड भी कराते हैं. 10 साल 11 साल वाले बच्चे भी जो उनको भी एनकरेज करना है कि वो भी मास्क लगाएं, वो भी डिस्टेंस मेंटेन करें, सोशल डिस्टेंसिंग मेंटेन करें.
While the third wave was predicted as early as in October, time is surely not on our side. We cannot have a repeat of what happened in the second wave, the struggle for oxygen and a mad scramble for life-saving drugs. The government must prepare on a war footing to save children from the third wave. The fear is real and the time to act is now. With Rishi Sinha, Anisa Kumar for CNN News 18.
So are we ready to save our children from a potential third wave which could possibly infect them? Joining us on the talking point tonight on Viewpoint is Dr. Sameer Dalwai. He's a member of the Pediatric COVID Task Force of the State Government of Maharashtra. Dr. Joseph Brito is ex-CEO of Isabel Healthcare in Virginia. And Dr. Amit Gupta is the Director of Neonatal Services at the Oxford University. Thank you very much for joining us, gentlemen. Let me start with Dr. Dalwai. Are we ready for a potential third wave which could possibly infect our kids, Dr. Dalwai? Dr. Sameer Dalwai, if you can hear me, that question
Hello.
was for you. Are we ready for a potential third wave, Dr. Dalwai, which could possibly infect our kids? Yesterday we had BK Paul, the head of the National COVID Task Force, suggesting that parents should encourage children to wear masks even inside the house, which, as any parent would tell you, as you would very well know, is easier said than done. So are we ready as a country for a potential third wave which could be pediatric in nature?
Well, that's a very interesting and important question, and we have no option but to prepare for it. So let me share with you what we are doing in Maharashtra. The government of Maharashtra has set up a task force of pediatricians, and we are already working at having created a module of what could be the guidelines in terms of the medical care if this so-called third wave has to hit children. And it's very clear that there are two parts to it. One is the medical part and the medical strategy in terms of classifying the illness as mild, moderate, and severe, but what is more, and preparing for the moderate and severe ones, of course, but what is more important is going to look at a public strategy and parental awareness or parent education. How do we deal with this fright that's being created everywhere else? And the most important message to give here, if you permit me, is that most of the children will be asymptomatic. You will never even realize that they got COVID and got better because there will be hardly any symptoms. Amongst those who are symptomatic, again, by far the most number of them will be mildly symptomatic. So they'll have a mild fever, they'll have mild cold, cough, little bit of vomiting, loose motions, and that's it. And this is the key issue. We want to tell these group of parents, do not panic, do not worry. What is very important is keep monitoring your child at home. In fact, we are even preparing charts that can be used by them for home monitoring. But make sure that you're in touch with your doctor, pediatrician, or family physician over the telephone and report to him daily. The issue is which are the danger signs. So if the child is getting high grade fever, not getting better with paracetamol, and if the child has some breathing issues and breathlessness, and if the child is turning blue, but more importantly, the change in the child's behavior. My teachers, Dr. Ambedkar, Dr. Merchant always taught us this, that a change in the behavior is a bigger sign of a problem. A child who's mischievous and running around suddenly becomes quiet, dull, listless, not wanting to speak much, not moving around, not eating and drinking much, signs of dehydration. Then these are the kids we need to look at taking them to hospital. The reason for this is the mild ones are better at home because you don't risk the infection again.
Let me ask Dr. Brito, one of the problems is, at least for adults, we have a vaccine now, whereas for kids, the pediatric vaccine is still very much in the clinical trial sort of phase, even in the US. For younger kids, Pfizer and other companies are just going through their clinical trial phase. Even here in India, Covaxin has just got the nod for the clinical trial phase for pediatric vaccine. So in the absence of a pediatric vaccine, how prepared are we, India and the rest of the world, for a possible third wave which could infect kids?
So Zakka, thank you. Thank you for the opportunity. We are all going to get infected with this virus, either with this strain, adult or pediatric. All of us are going to get infected either with this strain or the next strain. It's not a question of if, it's a question of when. And what we should be trying to do, and I think that's the point of your program, is to see how we can prevent these pandemic cycles, these surges that are occurring last year and now this year that we are in the midst of. What we should try and do is to say, what do we need to do to try and make it a seasonal infection, like other influenza viruses, coronaviruses, adenoviruses that cause upper respiratory tract infections. I don't think children will be, and there's a lot of noise about this, I don't think children will be disproportionately impacted. I don't think they'll be exempt, but I don't think they'll be disproportionately impacted. So for example, we sadly don't have the epidemiological data here in India, Zakka, but in the US, where 24% of the population is below the age of 18, 24% of their reported cases are in the below 18 age group. The hospitalization rate is 2%, and the mortality rate is 0.2%. So we need to have some perspective that the next surge, the next pandemic cycle, when it comes, I
just want to hold you there for a second. Just on the data, you said so 24% of the population is under 18, and 24% of that population is infected, or 24% of all the people who are infected by coronavirus happen to be under 18? I just want a clarification on that.
So Zakka, 24% of the US population is below 18. And of all the reported cases in the US, 24% of them are children below the age of 18. So it's proportionate to their population.
So that's in keeping with the population figures. Yeah, it's proportional to the population. But, the problem is in a country like India, for example, those under 25 are closer to 40% of the population. So I want to ask Dr. Amit Gupta, and he has a slightly contrarian take, a bit like Dr. Brito, that you don't think, Dr. Gupta, that this will affect kids. Forget about disproportionately so. You don't think this will be as virulent as what we have seen in adults, either in the first wave or in the second wave? You think it'll be much, much milder amongst kids. Why do you say that? And the reason I'm asking you that is because at every stage we are told that the virus is smarter than us, we are behind the virus's curve, and the virus is always seeking to infect those people who were not infected in the previous wave.
Thank you very much for having me on your channel. So you're absolutely right. I think we have got to get some perspective on this. Now, let's take the virus. Yes, mutations will happen in the future, and we don't know which mutation is going to affect which population and in what proportion. But the data so far, and that's what we've got to rely upon, the data so far says that the deaths and hospitalizations in children is exceedingly small. Dr. Brito put a figure of less than 2%. I mean, I think the figures range from 0.01%, 0.09%. So what I'm trying to say that what I'm struggling to understand as to what is making us so worried about the next wave. Now, the next wave, if it is with the same mutation and same virus that we've got here, has not disproportionately affected children so far. And I can't see a reason why they would attack that population in preference to the adults. That's number one. Number two, we are in the midst of a massive wave of COVID-19. Are we seeing our pediatric intensive care units getting filled up? Are we seeing excessive number of children dying? I don't think we get that sense from India, or that has certainly not been the experience in the UK either, or in the US. So what is important to emphasize here is the hospitalization rate for children remains very small. The number of children who get admitted to intensive care remains small. Death rate remains tiny. And I think that is the main thing to remember.
No,
yes,
I take your points there. I just want one clarification though. Yes, hospitalization rate is, let's say for argument's sake, under 2%. Even for adults, the hospitalization rate is maybe not 2%, but certainly is not, in double digits. Number one. Number two, in terms of the proportion of population who's getting infected, the figure that Dr. Brito said, 24% is a population of under 18, and 24% of all affected people are also under 18. So kids are likely to, if not have already gotten infected. And also, what do you say to the argument that why would it affect kids more than it affect adults? Because a large proportion of adults have either already got infected, or more importantly, a substantial number of adults have gotten vaccinated. Kids have not.
Absolutely. So let's take that first figure. Hospitalization. You said 2%. I think that's absolutely fine. Compare the children hospitalization with adult hospitalization. 8 kids versus 165 adults per 100,000. That's the proportionate difference we're talking about. So of the people who are hospitalized, of them, it is 8 versus 165. I mean, that's the difference in proportion of people who are ultimately hospitalized with COVID-19, and only 8 out of them are kids as compared to 165. That is very important. Okay. Secondly, yes, if you've got an adult population which is much more vaccinated, proportionately the number of kids who will have the virus may increase, but still the proportion of them having mild or a very mild disease is going to remain the same. So if we are not seeing hospitalizations now, when the case load is so high, I struggle to think what would make the number of admissions go up. I agree, of the total number of cases, the proportion of kids will be more, but the hospitalization rate should not increase. If it had to increase, it should have increased now.
Okay, fair enough.
So if it's not happened now, what would suddenly change for all those mild cases to suddenly become moderate or severe? So that is my point.
So Dr. Brito,
and so I think,
Amit, thank you, Zakka. When we're looking at vaccinating our children, when you look at a vaccine, you want to assess a vaccine from the point of view of decreasing the severity of infection.
Yes.
So there is good, robust data that the vaccines we have currently are very effective, will decrease the chances of you being hospitalized significantly. But we also need to look at the transmission. What is the impact of the vaccine on transmission? the data both in adults and children is very scanty right now. We do not know the impact on transmission. As Amit has said very clearly, the burden of disease in children now, and we hope in the future with the next surge, the burden of disease doesn't justify us taking on the risks of a vaccine at this point in time. The best way to protect our children today is to vaccinate the adults and the older adults in the family. Because the data suggests that transmission...
Let me be clear. Let me be clear about what you're saying.
I just finished this point, Zakka, please.
I just want to understand what you're saying. Are you saying that the risk of vaccinating the kids is higher than not vaccinating them? Is that what you're saying?
No, what I'm saying is when you assess the risk-benefit ratio, you need to ask yourself, for a vaccine for which we do not have the pediatric dose, what's the safe pediatric dose, and what is the efficacy and effectiveness of the vaccine in the pediatric population? Children are different from adults. Their children are naive from the point of view of exposure to pathogens. So we do not know what their immunogenic response will be to the same vaccine dose that you and I take. Therefore, we need to wait for the trials. We need to wait for the phase 3 clinical trials that will inform our decision as to whether we can, and remember, all vaccines are not equal. In time to come in India, it appears that we're going to have a smorgasbord, a cafeteria of vaccines to choose from. So we need to look at the efficacy of the vaccine, the dose, the safety, and the effectiveness. And bear in mind, transmission in the family, Zakka, takes place. Transmission in the family takes place not children to children, and not children to adults, but adults to children. And therefore, what we should be doing today is to vaccinating the adults in the family. Over.
Let me ask Dr. Dalwai. Dr. Dalwai. What I want to know from Dr. Dalwai is, again, I'm not sure, at least in the case of India, what Dr. Brito just said, it's not children to adults, it's more adults to children. At least in this second wave here, there is anecdotal evidence. I'm not saying there's empirical or people have studied this, but there is certainly anecdotal evidence of kids having transmitted this to adults. I don't know if that's your experience in Mumbai, Dr. Dalwai.
A couple of points that I am not in complete agreement very respectfully with him. One is that children are not naive to infection. In fact, we know that they are exposed more to infections because of schools, as well as they are exposed more to vaccination. Then there's no reason to believe this vaccination is going to be any more harmful in children than otherwise. The dose that he is mentioning about, at the most, it could be a smaller dose, and we might end up, having lesser requirement of doses. But I definitely think it's very important for children to be vaccinated for the simple reason we cannot imagine beginning schools in India unless a substantial portion of the population, especially children, are vaccinated. Because abroad, you have 10, 15 children in a classroom. Our classrooms are like a Mumbai local crowded train in the morning. You will have 40, 50 children in one classroom. True. You can never imagine having a distancing kind of thing or mask practiced by all of them. So the vaccination
so
is
you
very
are
important
you are
from that
you are
point of view.
actively
Coming back,
actively
just one moment,
proposing,
Zakka,
Dr. Dalwai, that kids should be vaccinated. Is that your position?
Absolutely. Just one more point, please. Yes. One more point about the reason for preparing. I agree with the numbers and statistics given by them, 2%, 0.2%. But there's a huge difference between the Western countries and ours in terms of numbers. If you are looking at 40% of the population below 18, that is about 60, 70 crores. If you look at 1% of it as well, do we have those? So I don't want a kind of a scare having been done there, but it's very important to be prepared about it. And that's why I mentioned the first time I spoke, it's very important public education so that we prevent, because what causes mortality eventually is not just the seriousness of disease, but overwhelming of the medical staff and overwhelming of the medical facilities. We don't want a large number of serious cases.
I'm afraid I have to hold you all there. Thank you so much, because we're getting a piece of breaking news. Dr. Dalwai, Dr. Brito, Dr. Gupta, thank you so much. But this piece of breaking news just coming in. here on Viewpoint. Tomorrow, we're given to understand that the Prime Minister will be meeting with district magistrates of various districts as well as senior field officers on COVID management. Remember, he had a similar meeting yesterday. So tomorrow there will be a VC at 11 o'clock in the morning. States including Maharashtra, Gujarat, Chhattisgarh and Bengal and the district magistrates from these states will be taking part in that meeting. Let's get more details. Payal has more information on this. Payal.
Zakka, about 9 to 10 states, with district magistrates and senior officers who are the foot soldiers on ground, the foot officers on ground, will in fact be sharing their experiences with the Prime Minister, will also be taking their feedback. This comes in on a similar line when the Prime Minister had a meeting yesterday, like you mentioned, with senior officers trying to understand from them what are the best practices that they have followed, what has really worked, what has not really worked, and how they can actually motivate people on ground to actually test, trace, track, and get treated as well. So these are the lines of this meeting is going to take place tomorrow. It's going to be important to see what the Prime Minister says after the meeting tomorrow, because remember yesterday also he spoke after the meeting, during the meeting, and he also said that he was, very much in awe of the kind of work that these foot soldiers were really putting in there, risking their own lives, risking the lives of their families, but still standing tall in the service of the nation as well. So it's going to be important to see what he says, especially when you expect some chief ministers to come. It will be important to see if chief ministers like Mamata Banerjee or Uddhav Thackeray among the opposition chief ministers attend this today in the meeting.
All right, Payal, we'll leave it at that. Payal Mehta there with more details on this meeting that's going to happen tomorrow at 11. The Prime Minister will be meeting district magistrates from affected districts in about 4 or 5 states. Meanwhile, one of the earlier affected states, and now there is a clear pattern of a downward trend, happens to be the state of Maharashtra. My colleague Vinay Deshpande, our Mumbai Bureau Chief, caught up with Maharashtra Minister Aditya Thackeray and asked him on a range of issues, from vaccination for all in Maharashtra, the global tenders that have been issued by both the Bombay Municipal Corporation and now the Pune Municipal Corporation as well, and also this whole scare around the black fungus. We're playing a small excerpt of that interview. The full interview will play tonight at 10 p.m. Thanks for tuning in.
Right now, there seem to be two concerns for Maharashtra. One is the spread in the interior parts, rural areas, the tier 2, tier 3 towns. And secondly, the rising number of cases of mucormycosis or black fungus. Is the state able to deal with both these challenges?
Yes, of course, the mucormycosis has been a large concern for us in the last 2 weeks, especially when the cases have started rising. We are, like I said, we've got our task force again to interact with all our doctors. Just last week, the Chief Minister, Mr. Uddhav Thackeray, along with the task force doctors, had a discussion with most of the GPs and family doctors across Maharashtra. And this is going to be a continuous process, because now what we believe is there needs to be an awareness amongst the people. And this we've tried in the last 2 or 3 months, where there is a sense of, concern in the people where you get COVID or you get COVID positive as a person, and you try scrambling for remdesivir or Fabiflu or for tocilizumab or for the steroids like dexamethasone and all. But we're only saying that, if you are testing positive, please go to your doctor and get the advice of the doctor and act only and only on that. Don't try to self-treat yourself in that case, or don't try to be home isolated without a doctor's prescription on that, or don't, self-medicate. It has to be as per the advice of the doctor, because every dose is very, very measured and as per the case. It's not something that you can generalize. So one is, of course, awareness, and two is treatment and the medicines available for mucormycosis.
At a time when the second wave had been quite ravaging, it is the Mumbai model which received a lot of praise. Are there any big takeaways about the Mumbai model?
I think we can be speaking about Mumbai model, Pune model, largely. Along with that, there is the Maharashtra model. I think the Maharashtra model largely focuses on one thing, that is absolute accountability and transparency in our reporting, in our cases, in our testing, because only when you have absolute true numbers can you strategize ahead and can you plan for the future and for the current time. So I think that is one of the things. Two, all throughout, like I said, having been transparent, having been accountable to the people and to the figures that are coming forward, we have largely focused on a couple of things. One is the medical response to the second wave, and we've already started planning for the third wave, ensuring that you have a bed when you need one, you have oxygenated beds, you have enough ICU beds, you have enough HDU beds. These are some of the things that we've been focusing on, along with a lockdown which was staggered. When we went into a lockdown, the Chief Minister, Mr. Uddhav Thackeray, actually prepared the mindset of the people, the cabinet prepared the mindset of the people, and then we went into a staggered lockdown, giving enough notice, which was well calibrated. So having gone into a lockdown, which many people are afraid to speak of as the word, Even today, it is the only way to safeguard your population.
Adar Poonawalla has also said that realistic time frame for vaccination of the entire population would be around 2 to 3 years. Is it only due to lack of available vaccines, or is it because of the numbers per se?
Now, in terms of, of course, he must have gone into the depths of it, obviously going into production details. But from a perspective of administration and administering the jab to people, I think if we have planning at a local level, and what Chief Minister also has written to the Prime Minister about, is about having a state-wise app, because a lot of people are also facing difficulty today with the COVID app, even though it is well made. We have like I said, crores of people trying to log in at the same time, and sometimes it crashes. If we have state-wise apps where we can share the data on a day-to-day basis with the central government, or we can make our own app and share the data, it'll be helping us better to prioritize our vaccination drives each day and go forward in a better way. So then we can reduce the time, because this has to be on a war footing basis. We cannot be lax on vaccination or be easy on vaccination at all.